Most people assume that Adderall or Ritalin are the gold standards for ADHD. But after treating thousands of patients for over a decade, my list looks pretty different. And my number one pick, it's not even close to what you think. Today, I'm breaking down my top 5 ADHD medications, not based on hype or prescriptions, but on what actually works in the real world. Some of these will surprise you. And one, most doctors won't even say it out loud. And who am I to rank ADHD meds like it's the NFL draft? My name is Dr. Sulman Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And after all this time, I've seen what truly helps and what just looks good on paper. Sorry, Mel Kiper. And oh yeah, let's start with a med that sounds terrifying until you see what it actually does. Coming up at number 5 is 𝒔𝒂𝒄𝒄. Yup, methamphetamine. Sounds kind of shocking, right? But here's the part nobody tells you. This version is FDA approved, can be prescribed to kids as young as 6, and in the right hands, it can work miracles. 𝒔𝒂𝒄𝒄 isn't street meth. It's pharmaceutical grade, ultra pure, and tightly controlled. The dose, sometimes as low as 5 milligrams. And I've seen it help patients who failed everything else. Adderall, Vyvanse, Ritalin, medications that you'll see on this list, you name it. The wild part? Some patients who got anxious and jittery on Adderall felt calmer, clearer, and more functional on 𝒔𝒂𝒄𝒄. Why? Because when it's delivered cleanly, it can actually have fewer side effects than more common stimulants. Yes, it's a Schedule II controlled substance, and yes, it comes with real risks. But when you've exhausted every other option, and no, this won't turn you into Jesse Pinkman or Walter White. This isn't reckless prescribing. It's strategic and in very specific cases only. 𝒔𝒂𝒄𝒄 makes my list not because it's common, but because, for certain patients, nothing else even comes close. For a deeper dive on 𝒔𝒂𝒄𝒄, check out this video I made via the card above. Up next, a medication that doesn't stimulate at all, and still delivers one of the biggest transformations I've ever seen. At number 4, it's Intuniv, generic name of guanfacine extended release. It doesn't spike dopamine, it doesn't supercharge attention, it doesn't even work right away. And that's exactly why it's brilliant. Intuniv is a non-stimulant that calms the prefrontal cortex. I turn to it when focus isn't the only problem. When a child's day is ruled by anxiety, sleep issues, emotional meltdowns, or tics that stimulants sometimes make worse. The downside? You need patience. Parents call me 3 days in like it's not working. But give it a week and I've watched explosive behavior fade into emotional control and calm focus. Unlike stimulants, Intuniv doesn't crush appetite or wreck sleep. No skip meals, no 2 a.m. wide eyes. And with 24-hour coverage, it can smooth out the entire day, from breakfast battles to bedtime drama. Clinical trials showed a drop-off of up to 21 points on ADHD rating scales, almost double the placebo. Because it's not a controlled substance, it's low risk and flexible. Most common side effects include sedation and lightheadedness due to the fact that Intuniv was initially designed as a blood pressure medication. So, drink your water when you take it. I rank it here because it flips the ADHD treatment questions on its head. Sometimes it's not, how do we get this kid to focus? It's, how do we help them feel safe enough to focus? Next up, a medication that is a stimulant. But with such a smooth delivery, most patients don't even feel it kick in. Coming in at number 3 is Concerta, or methylphenidate extended release. Not exciting, not trendy, but when you want smooth, consistent ADHD coverage all school or work day long, Concerta quietly gets it done. It's not just the medication itself, safe and reliable methylphenidate, it's the technology behind it. The Oros system releases a tiny starter dose, then trickles out more over 12 hours. That means no harsh spikes, no sudden crashes, just steady focus from morning till homework's done. I've had parents call back stunned. The after-school meltdowns disappeared. Their kid wasn't crashing at 3 p.m. They were still calm, focused, and present. Since it's methylphenidate, we're using a medication with decades of data. But unlike short-acting versions, this one fits real life. No midday doses, no nurse visits at school, no juggling meds during math class. With up to 80% of patients responding well, Concerta is predictable. And in ADHD treatment, predictability is a gift. It's number 3 on my list not because it's thrilling, but because sometimes boring is exactly what you need. Boring means dependable. Boring means peace. For more on Concerta, check out the video I made about this one via the card above. But if you're looking for something a little bolder, something more customizable, that's what makes our next medication shine. At number 2, we have Adderall, the name everyone knows, the one that built its reputation the hard way, by actually working. Adderall blends 2 types of amphetamine, targeting both focus and motivation. It's not just about attention, it's about drive, the kind that helps kids stay engaged in class, and helps adults get out of bed and get things done. In my practice, it shines for people who need that extra internal push, not just to pay attention, but to care about what they're paying attention to. And the flexibility? That's a huge plus. You need fast coverage for a specific window. There's an immediate release or short-acting version for that. Need all-day structure. Adderall XR or extended release gives you 8 to 12 hours of steady support, tailored to your schedule. Side effects? Sure, loss of appetite, sleep issues, dry mouth, but they often fade. And if they don't, that's where fine-tuning makes all the difference. Ensuring you have snacks during the day, making sure you take the medication at the best time, and getting enough water during the day will take care of those often enough. Adderall earns the number 2 spot because when it fits, it can be transformational. But the real magic isn't in the prescription, it's in the precision. Still, even Adderall has limits, and our number 1 pick, it solves one of its biggest ones. And the number 1 draft pick for ADHD meds is Vyvanse, or lisdexamfetamine, the ADHD medication that doesn't hit hard, but hits right. Vyvanse is a prodrug. That means it has to be activated in the bloodstream before it starts working. No instant jolt, no steep crash, just a smooth, steady curve that makes it one of the most tolerable and misunderstood stimulants out there. I've had patients who couldn't handle anything, Adderall, Ritalin, Concerta, come back after starting Vyvanse and say, I feel normal for the first time in years. They sleep better, they eat better, they're not wired or wiped out. They're just themselves. And that's the win. It's also harder to misuse. You can't crush it, can't snort it, or inject it for a high. That makes it safer for teens, and a lot less stressful for parents, as well as the go-to stimulant when there are concerns about substance misuse, which can make some providers a bit hesitant to prescribe a stimulant. For more on that, check out this video I made on treating ADHD with substance misuse concerns via the card above. No medication is perfect, but Vyvanse earns a top spot because it delivers what most people actually want from ADHD treatment. Focus that feels good and lasts all day, without turning you into someone that you're not. So that's my list. Not the most prescribed, not the most popular, just the ones that I've seen change lives. And your list, it might look totally different. That's not just okay, it's expected. The best ADHD medication isn't about brand names or buzzwords. It's about the one that works for you. The one that makes you feel focused, calm, clear, and still like yourself. If something in this video challenged what you thought you knew, or gave you something to think about, leave a comment below. I read every single one. And if you want more, well, I just ranked my top 5 antidepressants from the most overrated to the most underrated. Make sure to click below to watch that now. Until next time, be safe and be well.